Survive and Thrive is a training opportunity designed to enhance the skills of new local health officials at local health departments and provide them with the information, insights, and resources needed to lead their health departments. Survive and Thrive Fellows discover practical tools and tactics to help them engage elected officials and community partners. Learn how to use strategic planning and incorporate human, financial, and information resources, and bolster their ability to resolve challenges unique to their roles at a local health department. Participation in the program includes a 12-month commitment to active participation in program activities and assignments such as in-person workshops, distance learning, required readings, engagement with coaches and peers, and contributions to peer learning teams.
What would you use as your call to action to encourage others to participate in Survive and Thrive? What makes this program a worthwhile investment?
The Survive and Thrive program has truly been a lifesaver for me as a new health officer. I feel like it really gave me the support and encouragement that I needed to build my confidence as a new health officer. It helped me to see a much broader perspective of public health and learn from national colleagues instead of being focused with a narrow view from my small community that I came from. Being from a small community, I also didn't really have anyone else that could help to mentor me as a new health officer, and so I really relied on this program to help me understand what my role truly was. And it was a phenomenal investment of my time that not only helped to improve my leadership abilities, but I think after time you could see the results within my department and my community with what I was able to bring back from what I learned through this program. So highly recommend any new health officers who have the opportunity to be a part of this to really take full advantage of the program.
It's very interesting when you get a national perspective, and I think it's important to really get that perspective. And I think public health, we really need a unified force. So we're very grateful to organizations like NACCHO, organizations that really pull all the health jurisdictions, all the health departments together. And then of course, the most exciting thing is the rollout of the Affordable Care Act and how we're going to, what role we're going to play in our individual jurisdictions for that. So it's comforting to really hear what others are doing. I have a lot more ideas over the year.
Survive and Thrive is an investment not only on the professional side to get to know public health on a national level, it's an investment in yourself. And I don't know that you can put a dollar amount on what that investment will mean. The connections that Survive and Thrive brings to the table for the participants to make connections to NACCHO and to others engaged in public health on a national level, and the teammates that you meet not only on your own team but the other teams across the U.S. getting a view of public health from outside your own back door.
How has your participation in the Survive and Thrive program benefited your local health department, or how do you see it doing so in the future?
My participation in this NACCHO Survive and Thrive program has benefited me specifically and allowed me to take a lot of the lessons and things I've learned back to my health department, basically by providing a very safe space for me to talk with other health officers, talk about issues that I'm experiencing with our electeds, with our funders, with our staffing problems, and bring back some creative ideas that were shared during my meeting with all the other health officers.
It has benefited me on many levels, but I think the most significant one is one of the hardest things in public health is to make the community aware of what public health does and what we can do to prevent disease, promote health, and bring our communities to a better level of life and enjoyment. Awareness is something that's very difficult for us in public health because we work behind the scenes. Survive and Thrive has given me the chance to network with people across the nation who are also delivering programs that are related to public health and prevention of disease. Some of them have had enormous successes with programs that they have had, and now I'm able to tap into those successes and be able to take some of the best elements of those successes and potentially bring them into my own local health department and make my community a healthier place.
I think that the Survive and Thrive program has really helped me mature as a leader within my organization, but also within my community. I feel like I've been able to grow so much over this past year, and it's really enhanced my ability to be an effective leader and a manager among my staff, but also a leader within my community, and really has helped us to grow in our outreach efforts and our partnerships. And without Survive and Thrive, I don't think I would have had the confidence to do some of the things that I did in my first year as a new health officer. And ultimately, I think it really is helping us to be able, as a community, to improve the health and well-being of our community.
How has the Survive and Thrive program helped you with the daily responsibilities of your role as a local health leader over the past year?
What have I not learned from being a fellow the past year? I've been leading up in a better way than before I became a fellow. I have a coach, whom we call him the all-time coach, to pick up the phone anytime we have small issues. And especially the visit that he made, the shadowing visit that he made, helped us because he was able to talk to the upper management about the importance of implications of community engagement and mobilization, the core part of our project. And the other best thing we've learned is how no matter where we are from, even if we don't look similar, we don't talk similar, we can all come together. So I've learned the collaboration, the team player in a better understanding role, and how to empower the staff, because that was one challenge that we felt, all of us felt. How do we empower and engage our staff to get to the mission of the department?